This is Parusha. Today we will be discussing Namaste everyone. This is Parusha. Today we will be discussing the research paper on curing adenomyosis using Yoga Prana Vidya healing techniques. Before starting, let us invoke to the Supreme God, Divine Father, Divine Mother, to the spiritual teacher, Lord Mahaguruji Meni, all the great ones, holy gurus, holy masters, saints, archangels, holy angels, spiritual guide and helpers, we humbly invoke for your divine love, divine guidance, divine intuitions, and divine energy. For deeper understanding of this research paper of successful healing of adenomyosis using Yoga Prana Vidya technique. We thank you for your great blessings in full faith, with deep devotion and gratitude, with deep reverence and respect, and with lots of love. We thank you in full faith, so good, so good, so good. So let us understand the research paper on treating adenomyosis through YPV techniques. Adenomyosis is basically the adherence of the tissue, unnecessary tissues and tissue growth in the part of myometrium, as you can see from this photograph. In normal conditions, wherever there is a menstrual cycle, monthly menstrual cycle, the tissue growth is there in the endometrium. But in some condition, it goes to the myometrium, so it leads to the adenomyosis. This can cause, we can see from this photograph, the enlarged and swollen as well as tender uterus, and it may lead to the heavy and painful period with chronic pain. Sometimes even after the regular monthly cycle, the bleeding will start. Actually, the exact prevalence of adenomyosis is not known, but it is estimated that it is between 20 to 35% of the women worldwide suffering from the adenomyosis. It is most commonly diagnosed in the women in their 40s and 50s who have had children, particularly those who have had multiple pregnancies or C-sections. However, the adenomyosis can also affect women who have not had children, and it can sometimes occur in younger women as well. Some of the symptoms which is seen are the heavy and prolonged menstrual bleeding, severe cramping or knife-like pain during menstruation, chronic pelvic pain, painful intercourse, blood clots contributing to the increased menstrual flow, enlarged uterus causing heaviness in lower abdomen, and due to the heavy bleeding, it may lead to the chronic anemia, fatigue or weakness as well, and many other health problems. Exact cause of the adenomyosis is not known. There are some of the theories available, which includes that there is sometimes invasive tissue growth due to the C-section that promotes the direct invasion of the endometrial cells into the wall of the uterus. Another is that experts suspect that the endometrial tissues is deposited in the uterine muscle when the uterus is first formed in the fetus itself. Also, it is known another theory that there is a link between adenomyosis and childbirth. Inflammation of the uterine lining during the postpartum period might cause a break in the normal boundary of the cell that line in the uterus. So that led to your tissue growth in the myometrium. Stem cells origin theory is also available. This is the latest theory that bone marrow stem cells might invade the uterine muscles, which may lead to the adenomyosis. The medical method of the treatment is the hormonal approach. Hormonal treatment aim to regular or reduce menstrual bleeding or hormonal fluctuations that contribute to adenomyosis symptoms, which includes GnRH agonist, that is gonadotropin releasing hormone, which mainly used to suppress the excessive growth as well as the hormonal imbalance. Secondly, the progestin therapy, which is also the work in the same way. Another is surgical and pain medicinal approach, where the hysterectomy is sometimes suggested by the doctors. Hysterectomy is a removal of the uterus. Secondly is myomectomy, that is removal of myometrium. Another is dilatation and curettage, that is DNC. Dilatation and curettage means there is a dilation of the vagina is done, and through vagina there is the scratching of the excessive tissue growth is done, is known as curettage. Pain relief medication to relieve the pain also given. Now the patient history. This is very interesting case where the patient doesn't know when the treatment was started, and this was the case of distance healing. The patient is of 37-year-old female with 2 children. She already had a previous history of severe gastric problems treated by allopathy and homeopathy. She had irregular menstrual cycle, heavy bleeding, and painful period from more than 6 years. Along with physical issue of menstrual cycle, she had mood swings, anger, irritability, and anxiety during the menstrual cycle. Mostly we can say the symptoms of PMS, that is premenstrual syndrome. She had previous history of left ovarian surgery due to the chocolate cyst. Here we can see that the patient already had the experience of the not only allopathy therapy, but also homeopathy and surgical therapy as well. One day, suddenly, when she was in traveling with the family, she faced heavy bleeding after some days of normal menstrual cycle. Due to previous experience of chocolate cyst, she went for the medical advice, and the ultrasonography was done. The diagnosis as per the ultrasonography showed that there is a myometrium uterus was affected with the heterogeneous epotexture with few tiny cyst spaces, which we have already seen in the first figure, which is known as the adenomyosis of the uterus. Along with this, the back pain and some relationship issues also there due to the long-term problem. She was brought up by a single mother, so some emotional issues already there present, and the patient also had shoulder pain. It is very difficult for patient to walk normally since he was doing the digital marketing work due to irregular and problematic menstrual cycle. So what we did? First of all, the patient came through her mother. So we suggested her mother to say her. But then when she see the result, that just within 2 healing, the bleeding stop of the unnecessary menstruation, she came to know about the healing. So we suggested her directly the physical exercises and walking, rhythmic yogic breathing, which helps her a lot to cope up from the emotional issues, YPB diet, salt-free diet, and fruit diet. This help her to cope up with the gastric issues. And also planetary peace meditation was suggested to the patient. Since her husband was doing regular meditations, her relationship issues is also taken care when she has started the planetary peace meditation. Forgiveness sadhana helped a lot to improve relationship issues. And last but not least, that we have done along all with this YPV energy healing. Now there is a question, what is YPV energy healing? YPV energy healing is an ancient science and art of energy medicine. YPV energy healing is a process of renewing the energy body to bring change in the physical body. Used up energy which is there in the body can be replaced with the fresh energy to accelerate the body's natural healing process. It consists of cleansing the used up energy and energizing with the fresh energy. The healer channel and transfers energy. This therapy can be given complementary as well with other healing modalities like allopathy, homeopathy, and Ayurveda. As you can see from this figure, that there are three human beings. The incarnated soul extended into three bodies. One is a physical body, that is known as Pranamaya Kosha in Sanskrit, or energy body. Second is the Kamamaya Kosha, or emotional body, and third is Manomaya Kosha, or mental body. The beauty of the YPV healing that it's work on all the three bodies. This case is a distance healing, as the patient resides in the Mumbai. So we have started with the therapy, YPV psychotherapy, internal organ and blood cleansing techniques of YPV healing done, and affected part of the uterus is treated with the use of color prana healing. Total timeline and frequency is first when we started the healing, 2 times a day for first 20 days, from 12th December 2020 to the 31st December 2020. Then after that, once in a day, healing for 45 days was done. That is 1st January 2021 to the 14th February 2021. And after the proper treatment, we have continued with the preventive healing for 2 weeks. That is 15th February 2021 to the 28th February 2021. And the miraculous results have seen that adenomyosis was fully healed by YPV healing itself. Suddenly onset of menstruation stopped within 2 healings. And all other pains like shoulder pain, back pain, and all other issues is solved without taking medicines. No sign of discomfort is seen during the YPV healing therapy. Even doctor suggested surgery, but it was no longer required after taking healing. And the most importantly, all other emotional issues and relationship issues also cured. If you want to know more about this particular research paper or any other research paper of Yoga Prana Vidya, you can contact us or message us on this given link and number. So thank you very much all. Let us do Thanksgiving to the Supreme God, Divine Father, Divine Mother, to our spiritual teacher, Lord Mahaguruji Meli, all the great ones, holy gurus, holy masters, saints, archangels, holy angels, spiritual guide and helpers. We thank you for your divine love, divine guidance, divine intuitions, and divine protection. To better understand this research paper of successful healing of adenomyosis using YPV techniques. We thank you for your great blessings in full faith, with deep devotion and gratitude, with deep reverence and respect, and with lots of love. We thank you in full faith. So be it, so be it, so be it. Thank you everyone. Atma Namaste.